Let me ask you a few questions. If at least one of them sounds familiar, you should watch this video carefully. Does your back hurt for more than 3 months? Does the pain come and go, sometimes better, sometimes worse, but never fully gone? Do you feel stiff in the morning, tired of taking painkillers, or afraid that one day someone will tell you you need surgery? Maybe you tried resting. Maybe you tried random exercises from the internet. Maybe you are confused because one person says move more and another says stop everything. So the big question is this: how do you actually solve back pain? In this video, I will give you a clear, structured answer based on science, clinical experience, and practical strategies that you can start using today. No complicated medical language, no false promises, just real guidance. Back pain is one of the most common problems in the world. If it lasts more than 3 months, we call it chronic back pain. And this is where frustration begins. Many people don't even know the exact cause. It might be arthritis of the spine, spinal stenosis, a bulging or herniated disc, muscle-related pain like myofascial pain syndrome. Sometimes imaging shows changes. Sometimes imaging shows nothing clear. And this is uncertainty increases fear. I'm Jan Sosnowski. I'm a physiotherapist working in Dubai. Every week I help people who feel stuck with back pain. And here is something very important. Surgery is rarely the first solution, and pain does not always mean damage. In this video I will show you what really causes chronic back pain, why many people stay in pain for years, and 7 powerful non-surgical strategies that can help you take control. Let's talk about the real problem. Chronic back pain is not just physical. It affects your sleep, your mood, your work, your relationships. You start avoiding movement. You stop exercising. You cancel plans. You become more careful with every small activity. And slowly your world becomes smaller. Maybe you ask yourself, is my spine damaged? Am I making it worse? Will I ever feel normal again? Here is what many people don't realize. Pain is influenced by tissue sensitivity, nervous system sensitivity, stress, sleep, physical condition, lifestyle habits. Let me explain each one clearly. First, tissue sensitivity. When you have an injury, tissues become irritated. This is normal. But sometimes the tissue heals structurally, yet it remains sensitive. Think about a bruise. Even after it looks healed, if you press on it, it can still feel tender. In the spine, something similar can happen. A disc, a joint, or muscles may no longer be damaged, but they can still be more sensitive than before. And sensitive tissue reacts faster to load. That does not always mean new damage. It often means increased sensitivity. Second, nervous system sensitivity. This is extremely important in chronic pain. Your nervous system is like an alarm system. When you first injure your back, the alarm goes off. Pain is loud and clear. But if pain continues for months, the alarm system can become too sensitive. Now it reacts even to small triggers. Movement that was normal before, sitting for a bit longer, stressful day at work. The nervous system becomes better at producing pain. Not because you are weak, not because it is in your head, but because the nervous system adapts. Just like muscles adapt to training, the nervous system adapts to repeated signals. And sometimes it adapts in the wrong direction. Third, stress. Stress increases muscle tension. When you are stressed, your breathing becomes shallow. Your muscles tighten. Your cortisol levels increase. Tension in the back muscles increases compression on the spine. And stress also lowers your pain threshold. That means the same movement feels more painful on a stressful day than on a calm day. Have you noticed that your pain is worse during emotional stress? This is not a coincidence. Fourth, sleep. Sleep is when your body regenerates. During deep sleep, inflammation reduces, tissue repairs, the nervous system resets. If you sleep poorly, pain sensitivity increases, recovery slows down, mood worsens, and pain perception becomes stronger. Poor sleep and chronic pain often creates another cycle. Pain, bad sleep. More pain, worse sleep. Breaking the cycle is crucial. Fifth, physical condition. If you stop moving because of pain, muscles become weaker, endurance decreases, joints become stiffer, then normal daily activities feel harder. Lifting a bag, standing for 20 minutes, walking longer distances. When capacity goes down, load feels heavier. It's like trying to run a marathon without training. The body is not fragile, but it needs progressive training. Sixth, lifestyle habits. Long sitting hours, lack of movement, poor diet, smoking, constant rushing, no recovery time. All of these increase inflammation and reduce resilience. Chronic back pain is rarely caused by just one thing. It is usually a combination of sensitivity, plus stress, plus deconditioning, plus lifestyle load. And this is actually good news, because it means there are many entry points to improve. You don't need one miracle solution. You need small improvements in multiple areas. And when these small changes combine, pain often decreases significantly. If the original injury heals, but your system remains sensitive, pain can continue. And if you only rest, your muscles become weaker, your joints become stiffer, your tolerance to load decreases. Then even small activities trigger pain. This creates a cycle. Pain, less movement, weakness, more pain. If nothing changes, this cycle continues for years. But there is good news. This cycle can be reversed. Let me tell you something important. Most of my patients who come with chronic back pain are afraid. Afraid to bend, afraid to lift, afraid to move too much. But after we create a structured plan, things change. Not overnight, but gradually. And when they follow the strategy consistently, they start noticing less morning stiffness, fewer flare-ups, more confidence with movement, better sleep, more energy, less fear of activity, reduced need for medication, and sometimes no need for surgery at all. Imagine waking up and not thinking about your back first thing in the morning. Imagine lifting groceries without anxiety. Imagine traveling, training, playing with your children without constantly calculating pain. This is possible, but it requires understanding and the right steps. Now, let me show you the 7 pillars of solving chronic back pain without surgery. Foundation: movement and exercise. Number 1. Physical therapy and home exercise. Exercise is the foundation, not random exercise, not extreme workouts, targeted exercise. This may include core strengthening, gentle stretching, posture training, gradual exposure to movements that feel scary, light aerobic activity like walking or cycling. One important rule: consistency is more important than intensity. Your spine needs regular controlled load, not zero load, not extreme load. Movement improves blood flow, tissue tolerance, joint mobility, nervous system regulation. Avoiding movement completely often makes pain worse long term. You need a plan adapted to your symptoms, not a generic routine. Number 2. Mindfulness and nervous system regulation. Chronic pain affects the brain and nervous system. Stress increases muscle tension. Poor sleep increases pain sensitivity. Anxiety increases vigilance. Practices like meditation, breathing exercises, gentle yoga, tai chi can reduce nervous system overactivity. This is not psychological. This is neurophysiology. When your nervous system is calmer, your pain threshold improves. Lifestyle factors. Number 3. Anti-inflammatory nutrition. Highly processed food, refined sugars, trans fats increase systemic inflammation. A balanced diet with whole foods, vegetables, healthy fats, adequate protein supports tissue healing. Maintaining healthy body weight also reduces mechanical stress on the spine. Small changes done consistently make a difference. Number 4. Lifestyle modifications. Learn pacing. If lifting heavy boxes increases pain, break the task into smaller parts. If sitting long hours increases stiffness, stand up every 30 to 45 minutes. Avoid smoking. Smoking reduces blood supply and delays healing. Focus on one realistic change at a time, not everything at once. Number 5. Injection-based treatments. In some cases, trigger point injections, epidural steroid injections, nerve blocks may reduce pain temporarily, but they are not a long-term solution. They are tools to create a window of opportunity, so you can move more comfortably and participate in rehabilitation. Number 6. Alternative therapies. Acupuncture, massage, electrical nerve stimulation, biofeedback. For many people, these methods reduce pain intensity. They are usually low risk and can complement exercise and lifestyle strategies. Number 7. Medication. Anti-inflammatory medications, muscle relaxants, nerve pain medications can help in certain phases. But medication alone does not fix the root cause. Opioids are not recommended as first-line treatment for chronic back pain. They may reduce pain short-term, but long-term use leads to tolerance and dependency. Medication should support rehabilitation, not replace it. When is surgery necessary? There are red flag symptoms where surgery may be needed urgently. Loss of bowel or bladder control, progressive weakness in the legs, severe balance problems, rapid neurological changes. In other cases, surgery is usually considered only after conservative treatment has failed. It is invasive, it is irreversible, and it does not guarantee complete pain relief. Always consider second opinions before making this decision. The real strategy. Solving back pain is not about one magic exercise. It is about combining structured exercise, nervous system regulation, smart lifestyle adjustments, good nutrition, temporary pain management tools, gradual exposure to normal life activities. You do not eliminate pain by avoiding life. You reduce pain by rebuilding tolerance. If you found this video helpful, this is only the beginning. You can move without fear, reduce back pain naturally, avoid unnecessary surgery, and take control of your health. Just subscribe to this channel to watch the next videos that will help you achieve it. Your back is not broken, it is adaptable. Let's rebuild it together. See you in the next video.